Hello and welcome to another episode of Rational Actors on Blogging Heads. I'm Kevin Glass, and today I am joined by...
Dave Freddoso.
Yes, and David is at the Conservative Intelligence Briefing, and I'm with Town Hall. And we're going to talk about the ongoing disaster, well, we're going to call it a disaster, that is the implementation of Obamacare. And to be honest, David, I think that I have a little more faith in technocratic government than most conservatives do. And I thought that the rollout would be largely, there might be some snags here and there, but it would go largely smoothly. And even with all that, I thought that this was a bad law. But this, I think, is an unmitigated disaster, and especially President Obama's press conference last week in which he announced a kind of unilateral administrative non-enforcement announcement of the penalty for offering non-compliant Obamacare plans for a year. And it just seems to keep getting worse and worse. And at what point, I want to ask you, is there going to be a tipping point where there's going to have to be some fairly major legislative action to quote-unquote fix what we're seeing right now?
Yeah, well, that's a good question. I think a lot of it depends on the pain threshold that the Democrats are willing to tolerate, and the voters. Really, the two things are the same. At what point is this thing so bad that they will actually go along with some kind of partial or complete repeal, or just repeal the whole thing themselves? The only problem is that they've gotten themselves into at least a year of pain, and I don't know if there's an easy way for them to get out of that now at all. This thing it's a big system. It took up a long time to set it up. You can't just undo it overnight. You can't just ask insurance commissioners to change their entire state's insurance market like that. And even if you do, it's not necessarily clear you're going to solve all the problems you have with this law. I mean, we're seeing state insurance commissioners say we can't do this because it's going to destroy the exchange in our state. And they're right. It's going to have a negative effect if they do what Obama suggested. So, and at any rate, it's not going to change what's happening for most people in this coming year. And it's not going to change the fact that even if you put this off by a year, if we continue to have these slow signups on the exchanges, you're going to see higher premiums announced next spring, and then next fall, all the people being spared now are just going to get cancellation letters anyway, just in time for the election, of course. So I don't think that this solves. Even if we take Obama's solution at face value, I don't think it solves his political problem. But it adds so many practical issues besides that it's a major problem.
Right, and I want to talk about the practical issues, but what I think you said that was really important is the low number of signups that we're seeing. And it seems to me like even absent all of the website snafus, we might have been seeing very low sign-up rates in a lot of different exchanges. And I base that not on, I think that the Massachusetts analogy where I know a couple different progressive bloggers have been comparing the ACA signups to Massachusetts where they had incredibly low enrollment numbers. I don't think that that's an accurate comparison based on a couple of different conservative arguments that I've seen from Avik Roy and his co-bloggers work over at the Apothecary on Forbes. But I think you look at Obamacare set up these kind of transitionary high risk pools that went into effect I believe in 2010, and there were incredibly low sign up rates there as well.
Yeah.
And there's a potential, I think, that the estimate of the population who have been truly uninsurable for medical reasons might be a lot lower than a lot of progressives thought it was.
Yeah,
and that's part of a big reason why I think a lot of conservatives had problems with the whole Affordable Care Act in general, is that do you want to completely upend your healthcare system for a very small number of people, or is it a much larger problem? And I think that conservatives saw the pool of truly uninsurable people to be much smaller than progressives saw it to be. And that might be the case, and that might be part of why we're seeing this play out.
Yeah, my understanding, I was talking with Phil Klein at the Examiner the other day, who I think is out of all the people who, conservatives who understand the Affordable Care Act, I think he's one of the sharpest. And he was telling me that something like 600,000 people total had been denied health insurance based on pre-existing conditions over the previous 3 years. So that means we are talking about a small population in comparison to, say, the number of people being thrown out of plans. It's a small fraction of that. And it's also important, as we learned, you had a much smaller population sign up for the risk pools, and also a much more expensive population to insure sign up for the risk pools when it happened. It was only 100,000 people, and they blew through the entire funding allotment, the $5 billion, in no time flat, which they certainly didn't expect. They expected that they'd be able to insure many more people than the 100,000 who signed up at first.
Right. I think that they budgeted for something like 250,000 people, and I think the number was like $5 billion for 2 years, and they blew through the money. There was an initial, like I said, kind of it was slow to get started, but once they got to a little over 100,000 people, they canceled all new signups for the high risk pools because they had run out of money so fast. So I think that what you might see, and what conservatives might say, is that even if we were seeing a completely smooth rollout, that Obamacare would still be a bad law. And I think that part of the reason is because, and I wrote about this on Town Hall, is that I see Obamacare as a Rube Goldberg contraction, where every little thing has to go right along the way for the whole system to work. So you have to have these redistributionary measures that redistribute money and health and risk from young healthy people to old sick people, or even from old healthy people to young sick people. And a lot of it is tied up there. And if you don't get the people who you are trying to redistribute risk from signed up for Obamacare, the whole thing collapses.
Right.
And that's why the website snafu is so important right now. Because for it to work, and even if it did work, I don't think that it would be a good idea, but for it to work at all, you really need to get those people signed up.
No, that's right. And you have to make sure that you don't get risk pools that are just havens for people who were previously uninsurable, people nearing retirement who are living off their assets and have no income, so that they are able to get insurance for practically nothing. And that sort of demographic, if that's the sort of person who ends up on the high risk pool disproportionately, then you're going to be in really big trouble. And if that's what the insurers find, then this coming spring we're going to hear about much higher premiums announced for 2015. And again, this isn't, you mentioned Rube Goldberg is the inventor who liked to have a contest where you made the most complicated machine possible to achieve a very simple task. That's how this works. But once you set it in motion, you can't just stop it at one point along the way. I mean, we're stuck with this for next year in the insurance market. And you can't just undo it suddenly. There's no easy way to do that. So, all of these, every insurer, there are some states where the effect will be felt less because some of the states allowed people to renew policies for up to a full year. But, every insurer has to file with the state insurance commissioner what plans are going to be offered. You can't just change that all of a sudden and, come up with completely new premiums without going through an entire state bureaucracy. This may be something that, people don't understand, but once you've set this in motion, it's basically you got to let it play out. There isn't really, and this is what the insurance commissioners in Washington State and Vermont and Oregon have and DC who got fired for it, but that's basically what they've shared. And the additional problem is that if you let people out of entering exchanges by doing this, by doing this thing where you're letting them keep their old plan, you're going to create more of an adverse selection problem, which means, again, you're going to end up with the wrong people or the wrong composition of people, not enough healthy folks signed up because, well, who are the healthy insurable people? We know that among people who already have insurance, that there are a lot of insurable people that we want in those exchanges. So there you have it.
Right. Yeah, and what I thought was interesting is that so the Republican strategy on the Hill was to go after the individual mandate, right? Is that they wanted the individual mandate to be delayed by a year. And that was the hill that Democrats staked their flag on. They said that was something that they could not compromise on. And based on the structure of Obamacare, they cannot compromise on the individual mandate. Which seems odd because President Obama was very eager to delay the employer mandate. But the employer mandate was actually kind of a promise, or was a policy trying to keep his promise that if you like your plan, if you can keep it. Because in the absence of an employer mandate, your company might dump your health insurance and push you onto the exchange, right?
Right. They would have every incentive to do that, yeah.
Yeah, but the individual mandate, if that gets delayed, like you said, the pool of people in the exchanges is going to skew a lot older, is going to skew a lot sicker. You're going to see those premium increases announced next year. And you start getting what a lot of health policy experts call the death spiral, where the pool gets sicker and sicker and sicker, the mandate isn't strong enough, you don't get people signed up, and basically the exchanges become these kind of optional places where you go to get insurance only if you're sick, and healthy people just completely stay away.
Right, exactly.
And that causes it to be a lot more expensive, causes the subsidies to be a lot higher, et cetera, et cetera. And the mandate itself actually isn't, especially the Obamacare mandate, isn't strong enough to get those people signed up. Even in Massachusetts, where the mandate is much stronger, they don't have 100% compliance rate. So you would need, and you can't have a stronger mandate for political reasons, because it looks terrible to say we're going to fine you $15,000, $20,000 if you don't buy health insurance, which is why it starts at $95, which is basically nothing compared to the cost that we're seeing people have to sign up for on these exchanges. And it gets stronger, but it's never going to be strong enough if the pool of people in the exchanges really becomes truly sick and becomes those people who were uninsurable.
Yeah, and not only does it start to, cause healthier people to stay away, some of them who have bought insurance through the Affordable Care Act could even bail out because the prices just get too high. And if I'm a healthy person, I'm not spending a lot of money, and no one's spending money on my behalf on health care. I haven't seen a doctor in several years. Then it seems like a bad deal if I'm going to be paying $400 a month for an insurance policy that I'm unlikely to use, especially as long as I can save up enough cash to get me to the next open enrollment period, I can just get insurance after I get a serious disease. And in the meantime, just pay out of pocket to go to a doctor. And, when the hospital bills start coming, if I get hit by a bus, maybe I have an HSA with several $1,000s in it. I can at least start making payments to the hospital before open enrollment hits, and then just enroll in one of these exchange plans when suddenly it's worth it. So there are a lot of, it's not as simple as you can just buy insurance as soon as you get sick, but it's not that unlike that. And that's always been a snag in this law that, nobody wanted to listen when this stuff was being pointed out. So, you see a lot of people who supported this law, politicians, paying a political price now.
Right. And that's actually a point I wanted to ask you about this. So some people now are accusing conservatives of kind of rooting for failure, right? And we saw this during the debates around it. We saw Democrats saying, Republicans want you to die. They don't want you to have health insurance, blah, 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 blah.
Yeah.
And in the case now where there's a lot of, snafus, glitches, whatever you want to call them, and conservatives are kind of pointing out, hey, we told you so. Some progressives are saying you're rooting for failure. You're hoping for this to fail so that fewer people get health insurance. Do you think that that is an effective counterpoint to what some conservatives are saying right now?
Well, I think that's kind of the loser's argument. It's almost like you're rooting for it to fail. Okay, fine, but I'm not making it fail. It's failing because it was always going to fail. In fact, I almost think rooting is the wrong word. It's been predicted to fail for so long. And conservatives who pointed out a lot of the flaws in this law, to say nothing of just the general concept. And again, this is where the technocracy question comes in. Can government do something like this? Can we centrally plan an entire health insurance market and have everything go off, reasonably well? And I think what we're seeing is that when you take on an enormous project like this, only a few things have to go wrong for it to come crashing down. I mean, the website is not, Obama's right when he says Obamacare is not a website. But the problem is that without the website, the whole thing could fall apart simply because the most persistent people who actually get through and sign up for insurance in the exchanges are really sick people who otherwise wouldn't be able to get insurance. So, something as simple as that, you just can't get your website working but then everything goes wrong, which seems to be happening now. You can't actually pay for your policy through the website apparently now. Many of the state websites are complete disasters. Vermont and Oregon, they haven't been able to enroll anyone basically. Oregon, it's zero. Vermont, they've actually had people sign up, but they can't pay for it through the state exchange. So you're having these problems all over the place, and this is inevitable. I mean, as a conservative libertarian who believes in, if I can just shift gears and make a foreign policy analogy, one of the strongest arguments for presuming against war, no matter what, is that when you give a bunch of rifles to 19-year-olds and send them out in the field, no matter how well you train them, you're going to have them commit atrocities. You're going to have horrible things happen both on purpose and by accident, and it's just inevitable. So if you're ever going to fight a war, you have to have a really, really good reason to justify creating that danger. Well, this is true really of everything government does, that it's very likely to go wrong. It's more likely than in the private sector because no one's actual money is on the line. None of the people implementing this stuff have any skin in the game. So you could almost say, yeah, it's almost inevitable that you're going to have some kind of big problem because in the end, it's whoever's building this thing and forking out so many millions of dollars to create state exchanges. I mean, Vermont's doesn't work. And they spent $168 million, which is, it's like $4,000 for every uninsured person in the state, which is just crazy. You could have bought them insurance in the old market for a couple years with that probably. So, or at least a year and a half. So, this is something where you see government by nature being bad at things like this. And you also see specific things about this bill being constructed in a way that just isn't going to be able to thwart individuals' self-interest. Which again, going back to this whole question of, well, why should I carry insurance if I'm healthy if there's a way that I could get on it later when I'm sick?
Yeah, Vermont and Oregon strike me as particularly important examples because I've seen some people say that, the state exchanges are working better than the federal exchange. And if only, the intransigent governors of those states that declined to create state exchanges had created exchanges, we'd be seeing a much smoother rollout and much better implementation. But Oregon and Vermont are places where clearly you have a lot of Democrats, you have a lot of people who are in support of the law. You're not going to have the evil Republican boogeymen trying to mess up your legislative process in Vermont and Oregon, and yet we're still seeing a lot of these same problems that plague the federal system and plague a couple other state exchanges as well. So I think that that's kind of the counterpoint to, evil Republicans are rooting for this law to fail, and if only they were on its side, then we'd have, a much better transition into this new system.
Well, if Republican well wishes could make this law work, then it wouldn't be having all the problems it's having. As things stand, it's once they actually get the computers working, there are a lot of reasons to believe that things are actually going to get a lot worse for Obamacare, because you can't just create demand for paying twice as much for insurance, or you look at the cancellation victims, especially who were essentially lied to by the president, and this is a group of people who is almost certain not to benefit from this law. And it's not just because they're being taken out of something they like and thrown into who knows what. It's also because the people in that situation are the ones who are less likely to qualify for subsidies, because, it's just the demographic focus of it. I mean, you're looking at a more upscale group of people who have actually gone out and bought insurance, who think about things like buying insurance. Much less likely to be in a position where they're going to qualify for a large subsidy that lets them have insurance for free, and at the same time they're being thrown out of the insurance plan that they liked. So you've got a lot of really irate people out there, and many of them were supportive of President Obama. Many of them are younger people at the beginning of their careers, making a salary that's just above or just under 400% of poverty. They're not going to get much of a subsidy in that area. Like maybe they get $17 a month in one guy's example that I saw. So you've basically created a recipe for some really, really strong voter anger that's going to result in a big backlash. I mean, unless something happens quick, right. And I just don't know what it would be. What's the Deus Ex Machina that's going to save Obamacare? I think once they get the website working and people go on and see, hey, that looks just like my old policy and it costs 3 times as much and the deductible is higher, well, what's going on here? I think the problem actually gets a lot bigger.
Right. And this is a productive discussion, I think, of who the winners and losers are under Obamacare. And I want to give progressives some credit. We've been focusing a lot as conservatives on who's losing under Obamacare.
Right.
There will be winners.
Yes, there will.
There are people who are truly uninsurable, who face enormously high medical bills, who face medical bankruptcies, and people die for lack of health insurance and health care in America. And some of those people will be helped by this law. In fact, a lot of those people will be helped by this law. But I think that the all or nothing kind of approach there is not really productive, because, and I want to say this too, Republicans ignored a lot of these problems for a very long time.
Yes, that's absolutely true. I just posted on that very issue, if Republicans ever, right now we see Gallup returning to the territory or perhaps for the first time going to the territory where a strong majority of Americans, 56 to 42, do not believe it's the federal government's responsibility to make sure everyone has health insurance. But if you go back to just 2006, that only 28% thought it was not the federal government's responsibility. Now it's 56%. So our minds have perhaps been concentrated by this failure, but there's nothing permanent about public opinion. And if you don't fix the worst things about the old system, if you don't reform it, in order to, and a more center-right reform is going to start by getting rid of government tax distortions that are being created in the system. If you don't do something about it, you're just asking for the other guys to come along, as Obama did, and demagogue the issue and act as if this is easy and we can just, by saying so, make everybody have insurance. I think it's really important with this current law to look at, okay, if there are 40 million Americans who don't have insurance, how many of these are we actually going to insure? And, insure newly. So we're not talking about people who go on the website and say, oh, wow, I get a better deal, I'm going to sign up for Obamacare. We're talking about people who have not had insurance, who hear about healthcare.gov or about Obamacare, go on, get insurance for the first time, or sign up for Medicaid for the first time because they were eligible before and they never did, or because they're newly eligible under the expanded Medicaid in various states. The numbers on that, if you're not even going to insure a small fraction of the people who lack insurance right now, and yet you're going to throw all these millions of people out of something they hadn't liked where they were able to pay their own way and did. You have to start wondering about the proportionality of that law,
right,
and whether it was a good idea. Because sure, I can insure a bunch of people, but if almost the same number of people are losing insurance, if all we're really doing is transferring all of these cancellation victims from one insurance policy to a different one, to say nothing of, the new one being more expensive, higher deductible, and generally a worse deal for them. If that's all we accomplished, then what have we done? We haven't actually insured the uninsured.
Yeah, exactly. And you start to get into some real cost-benefit analysis, because you say, how many people are actually going, like we started this off, how many people are truly uninsurable, do face the medical bankruptcies every year, and how many people are you harming by forcing everyone else into this new system?
Well, and it's worth mentioning also that, medical bankruptcies are still going to happen. I mean, 40% of America, if I recall correctly, is in debt. If you have no debt and $10 in your back pocket, then you're wealthier than 40% of America. I think that's the stat. It's something like that.
Something like that.
Google it, look it up online. Yeah. So, when somebody faces a $10,000 medical bill for their family and their, ACA exchange deductible is $12,000, you're on the hook for that money. Sorry. You're just as much up a creek as you were before Obamacare. So it's not like this is going to change everything. In most medical bankruptcies, the people actually do have insurance, and
right.
It's not as if this just waves a magic wand and makes everything better.
Right, and I'm interested to see charges of heartlessness come into this discussion, because if you're, let's say, a healthy-ish person who declines to sign up for the Obamacare exchanges and pays the tax penalty or whatever, and then gets hit by a bus and faces medical bankruptcy, do liberals then say, oh, well, it's his fault, he should have had insurance? Because that's kind of what not Republicans, but conservatives would say now under the pre-Obamacare.
Yeah. If you go without insurance, you're taking risks, right?
Exactly, and there will be people who go without insurance and pay the tax penalty. And do progressives then say, "Oh, you're out of luck. Sorry, you didn't sign up for what we told you to sign up for. Tough luck now," which is kind of what progressives accuse conservatives of saying in the pre-Obamacare status quo.
Well, I mean, I suppose you could say that they have a more moderate position on individual responsibility, that you're going to be given this opportunity to have this, and you're going to be kind of not just carroted, but sticked, sort of cudgeled toward it with fines or taxes or whatever we're going to call it. And then if you still won't listen, then that's it. We've had it with you, and we don't care if you died, broke because you needed medical care. At some point though, you have to give them credit for saying people need to be responsible, at least in that instance. And when it comes to people not being able to pay for insurance, that's actually the problem that is not as hard to solve, or not as complicated as the pre-existing conditions question. Really, I think that this entire law hinges on that pre-existing conditions question, and not so much on the people who can't afford it. If we wanted to make insurance more affordable, we would let everyone buy from Iowa, where it's much, much cheaper in the individual market than it ever was in, say, New Jersey. In states where they have guaranteed issue and community rating, you end up with insurance policies, premiums that look more like rent payments, and then in Iowa you can buy it for less than $100 a month, and it's decent insurance. You're going to have a bit of a higher deductible at that price, But, I mean, I was living in DC, and had this, $62 a month insurance with a $2,700 deductible. Seemed okay to me. And they're selling that same policy now for a multiple of what I was paying with a higher deductible. So, if you wanted to make it cheaper, there are solutions out there that don't involve government seizing control. Simply being able to buy from a different jurisdiction could solve a lot of that problem, because states over time have allowed special interests and lobbyists to come in and say, well, we want you to make a law that says that, the acupuncture lobby says we want acupuncture in this. The chiropractic lobby says we want chiropractic to be covered. Marriage counselors have even gotten in some states like Maine, where they make your insurance, you cannot buy insurance that doesn't cover marriage counseling. This stuff makes it all a lot more expensive. And then when they put in guaranteed issue and community rating, so fine, you can get rid of a lot of that stuff overnight and make insurance more affordable for people. But what about people with pre-existing conditions? I think that's where the real issue is here. And that's what's killing Obamacare now, ironically. It's also the most important problem that it sets out to solve. With pre-existing conditions prior to Obamacare, and actually you mentioned it before, where they're trying to extend some of these, you had these high-risk pools in most states. Many of them were subsidized, so that basically if you had a pre-existing condition, that you would expect to pay more for insurance, but not that much more that it was impossible for you to get. And that, it would be based on your income. The state would subsidize what you were paying. So lots of different states, Washington State, Texas, Maryland. This wasn't a red state or a blue state idea. This was an idea that the states saw actually worked for people with pre-existing conditions. So you're going to pay a higher premium in that situation, but you're also going to have insurance. And, the fact that you're getting all this treatment means that paying a bit more for it is a lot less, painful for you. You're like, well, I can see the benefit immediately. Maybe I am paying $300 a month, but I could be paying $30,000 a month for my expensive pre-existing condition. The thing that Obamacare tries to do that I think is a big mistake is it says, we're not just going to make sure these folks get care and have coverage. We want to make sure that they are always going to the exact same market and treated exactly the same as anyone else, instead of being treated as the special cases they are. I mean, again, about 600,000 people over 3 years being denied. And on the basis of them, I mean, you want to help them, but do you really want to overturn the entire existing insurance market in order to solve a small problem that maybe you could solve by looking more specifically at those folks' problems?
Right. And this kind of troubles me, actually, is that even now in the current environment we're in, where healthcare policy is at the forefront of every kind of political discussion right now, Republicans still don't really have anyone driving their side of the conversation on healthcare, on what, like, the Republican answer on Capitol Hill right now is just repeal Obamacare. There isn't a replace plan for all that, they like to talk about it.
Well, there are some replace plans, actually. There are two of them. There's the Price bill and there's the Roe bill. And they take different approaches, but you're right that Republicans have not coalesced behind one alternative to Obamacare. And you're also right that most of them don't know. I would say most members of Congress have no idea what those bills specifically do, let alone the general public. And there's just no conservative discussion about healthcare, because conservatives hear healthcare and their eyes glaze over and they think, I'd rather be talking about missile defense or some other issue, just not healthcare, please, not healthcare.
Yeah, and let's be honest. The legislation on Capitol Hill out of the Republicans right now is piecemeal. It's very small. It would contain very small reforms. It wouldn't make huge impacts in the number of uninsured or the overall price of insurance, which are the two main things that you have to kind of target when you're talking about serious healthcare reform. And it's kind of disheartening, and to a certain extent, it's what a political party is going to do, right? You're going to run against, you would rather run against something than for something. So
Right.
it's easier to say no than put your own plan out there. And Democrats didn't have a plan either before President Obama came into office. You know, we all remember the 2008 primaries where, you know, the major substantive disagreement between Barack Obama and Hillary Clinton was, should you have a individual health insurance mandate? And Barack
Right.
Obama was against it. Only to come into office and take Hillary's plan, basically.
Exactly.
Or her, you know, primary plan. So it's not surprising that Republicans, A, haven't coalesced around a plan, and B, don't have a plan that would make serious strides on either the issue of uninsured or costs. But it's still kind of disheartening to see that, you know, Republicans on Capitol Hill aren't listening to the healthcare wonks. They're not listening to the Tom Millers or the James Capretas or any of those people who I recommend that everyone watching this go and read because they're some of the smartest healthcare minds around. But they're, you know, those names aren't known by almost anyone on Capitol Hill, and they should be.
Yeah, no, that's right. There has been a real deficit in terms of candidates and you know, sort of public thinkers really grappling with this, and it's about time, or at least no one's giving proper recognition to the public thinkers who are grappling with it, I think is maybe a better way of saying it. But it's an issue that has to be dealt with. It's not, as much as Republicans complain about Obamacare, it's not as if the market before it was much to write home about. And in fact, that's how you can get something like Obamacare, is to have a dysfunctional insurance market in the first place. We have the best care in the world in the United States, but we've always had one of the worst systems of healthcare. Not the care itself, but everything surrounding it, the way things are priced, the way things are paid for, and the way that the costs have risen. None of that is necessary for us to have a good healthcare system. But we've stuck with this sort of defective system surrounding the care.
Right. I think that's probably about all the time we have for today. But this was a really, really good discussion. And I encourage everyone to go read what David's been writing because he's been great on the Obamacare rollout. And hopefully, you know, I'm not rooting for failure. I'm rooting for Obamacare to work as they said it was going to work, and then have what conservatives said the consequences would be, which is that, you know, we'd see a lot higher prices, we would see much fewer people insured than promised, and that, you know, Medicaid is still going to be a fairly large budget strain on both the federal government and the state governments. But I think that the rollout is going to continue to be a very serious issue for President Obama in the next few months.
Yeah, and anyway, you can already see the senators and members of Congress diving for cover. It's often not knowing what to say because they are, it's kind of, you're kind of at the point of breaking ranks here and not necessarily repealing the thing themselves, but certainly disowning it, distancing themselves. You're seeing a lot more of that, and it's going to be just a really tough. It's going to be really tough for a lot of these folks, especially the senators who who voted for it and have not been up for re-election since, and are up for re-election in 2014. Those folks are going to be the hardest hit.
Yeah. All right. Thanks a lot, David, and hopefully we will have another one of these soon. But thanks a lot for joining me today.
Thanks so much, Kevin.